Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Good evening, everyone, and I hope your day has been absolutely wonderful. I'm Dr. James Marcum, and I want to welcome you to the Heart of Health Live, where you are the program. And we have an allergist with us today, Dr. Raschal, and she actually sees patients every day, so she's more than qualified to answer your questions. We're going to meet her after the break, and you can give us a call. Our number is 855-644-3278, or if you want to text us a question, it's 423-834-7307. What's interesting about the Heart of Health Live is you are the program, and there's no such thing as a dumb question. All questions, if one person has a question, many will have it. We're fielding many that have allergies. And everyone has allergies, or has someone that has a food allergy or has a question about it, or might be allergic to a medication. This is your chance to ask your question. Dr. Rachel's not getting paid. She's just going to give you good, straight answers. And if you want to learn more about HeartWise, check us out on our website. That's heartwiseministries.org. On the website, you're going to find a place that you can find healthy restaurants, places to eat, an Ask the Doctor section. You can archive old programs. Or more than that, we also have a prayer team. And just this afternoon, we asked for prayer for those that need the ultimate of healer to intervene in their care. So we want to invite you to join that. So after the break, we're going to be talking with Dr. Raschal, and there's so much going on in the news these days. You know, we've been hearing about the Ebola virus all over the place. They recently came out with a study this week about women and mastectomies. There's so much out there. Sometimes it's hard to know who or what to believe. But we at HeartWise believe that the real solutions to life problems are in this book called the Bible. And we try to use biblical principles to solve problems as well in the healing world. So stay with us. Dr. Rachel's going to be back. Our phone lines are open. Give us a call, 855-644-3278.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by HeartWise Ministries. HeartWise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartWiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Body language. Without saying a word, can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We are waiting for your call. You are very important to us, 855-644-3278. And if you happen to be searching through channels, stay right here. You're going to learn something great. Dr. Raschal, welcome to Heart of Health. You've been here before. We're glad you came back. We didn't scare you away.
You didn't.
Well, tell me, it's a rough world out there. Medicine's changing, you know, more paperwork, less time with patients. It's a lot different world. How are you surviving out there?
Well, the truth is two things. The number one thing is everything that you do for the glory of God. And He's going to see you through. But I really think, I really think that one of the things that we need to do is educate our patients about some of the hurdles that we have to get over. Because I really believe that if they were more aware of what it is that we do on a day-to-day and what insurance companies, what pressures insurance companies are putting upon us, if we could make a way to explain that in a way that's easily understandable, I think people would be more likely to start defending us, their docs, to insurance companies. For an example, when we choose a medication, and we submit that medication, send it to the pharmacy, we frequently will get a rejection, denial, denial, denial. And the pharmacist will tell the patient, talk to your doctor about completing this prior assistance or this, we have to get this PA completed.
Right.
So in doing so, that takes my staff, takes their time, and they've got to fill out this form, submit it to the insurance company, and then sometimes it'll go through, this prior approval will go through, and sometimes it gets rejected. If it gets rejected again, then it's me involved. I have to do a peer-to-peer. I've got to talk to a doc who says, yes, what you're doing is correct, and we'll go ahead and approve that medication, that procedure. Or they'll say, no, we don't. We still don't approve it. We need all this documentation. There are several docs now that what they're trying to do is put the onus on the patient. So the patient has to do the legwork and try and get medications approved, that they are unwilling to do that. That's one of the things that physicians do not get paid for. Right. So this is, again, decreasing the amount of revenue that we generate, requiring us to see more patients and get less money. So it puts, unfortunately, I hear patients all the time when they come see me tell me how little time their docs are spending with them. Yeah. And just like you said, one of the big concerns is, why is that happening? It's not because the doc doesn't want to spend the time with the person. Right. It's because that all these restraints, if a doc wants to make the same amount of money that they made 5 years ago, they need to see several more patients a day, and they have to spend less time with each patient. Right. So it seems like we are in a catch-22 as a physician, because we do want to spend the time with the patient. In our practice, and probably yours too, Dr. Marcum, we do spend that time, but what it means is that we make less money. Now, the other part of that is how much money is enough.
Right.
And what I say to people, if someone is blessed and they're making $1 million a year, what I say is, that is fabulous. But then what I'd like to see them do or know is that they are giving that money, yes, through their time, talents, and treasures. And those are the things that are so important. Yeah. And so I think that if our patients really got the feel and recognize how important it is for us to be able to survive by them picking up some of the slack, or by them contacting the insurance company saying, you know what, this isn't fair that you're making my doc jump through all these hoops to get this approved or to get that approved. When they're the expert making that decision, they feel like that's the best medicine for me, why not just approve it?
Right, right. And so, so if your doctor is out there, give them a hand. Say a prayer for them.
Yes, yes.
Give them a hand. And we're just glad that we're able to answer some questions. And our first question has already come in. Pammy, you're on with Dr. Raschal. Go ahead with your question, Pammy.
Hi. I'm kind of nervous.
Okay.
Since like about 3 or so months ago, I started getting blisters on my tongue, and I haven't changed my diet or anything like that, and I don't know what's causing it.
Blisters. Interesting question. Not necessarily an allergy, but one of the things that we have to know is, has there been a lot of stress? Some people who get blisters is actually a cold sore, and we know that herpes viruses are very common, and they can result in a blister. Usually it's on the lip, but it can be inside the mouth or the buccal mucosa, which is inside, or it can be on the tongue. So it depends. Now, other times you get blisters. There is something called, and you may have heard of this, called burning mouth syndrome.
Yes, I've heard of that.
Burning mouth syndrome is a real problem. Sometimes people feel like they've got a scalded tongue. It's frequently the way they describe it. And some folks will have blisters on their tongue. Unfortunately, we're not clear exactly what the culprit is for that burning mouth syndrome, but other things need to be looked at. The other possibility when it comes to blisters on the tongue is sometimes, and here's the sneaky thing, it doesn't have to be something new that you've started using or a new food that you've started ingesting, but toothpaste, for an example.
Yeah.
Some people develop a contact dermatitis. There's something called cinnamonic acid, which gives a cinnamon taste, and it usually is in toothpaste. So toothpaste may have an ingredient that you have used for a million years, and suddenly it causes a problem, and it may result in blisters on the tongue. So there is a huge differential diagnosis to try and identify that. But I really can empathize with you because it's very frustrating.
So what should she do? Should she just keep an eye on it?
Right. So that's a great question. You know what I usually suggest that people do is show it to your primary care doctor. Definitely keep an eye on it. See what makes it worse. Does it make it worse after you brush your teeth? Does it make it worse after you've eaten something? If you're stressed out, do you get more of them? Do you get a greater population of them? So those are the things to look at. The other thing is I would suggest old-fashioned remedy. Gargle with salt water.
There you
See
go.
if that's going to make a difference. Because salt water is great for lots of things, so I want you to try that. But the key thing, write down your symptoms, write down when they occur, the circumstances surrounding them, and also if anything else is affecting them.
Great. That's a great answer. And Pammy, thank you.
Yes,
That's a problem that so many people have, and there's no easy fix sometimes. But make sure if it doesn't go away, see someone, make sure it's not a manifestation of something else. But thank you for calling. Our next caller is Joan from Florida. Joan, you're on. Go ahead.
Hi. Good evening.
Good evening, Joan.
My question is, I get little blisters, well, not blisters, little bumps on my knees. And, if I try to kneel, they're painful. But if I walk, it doesn't bother me. And I notice at the same time, like when I get up in the mornings, my joints of my fingers are a little stiff and somewhat painful, but, it goes away after a while. I don't have rheumatoid arthritis. I don't have gout. So I don't know what's causing I kneel a lot because I pray a lot, but I don't know if that's the cause it. I get it like every 6 to 8 months or so. I don't know.
So blisters on knees.
Okay. It sounds like it wasn't blisters, it was bumps.
Bumps. Okay.
So a couple of things. Again, this could certainly be a manifestation of contact dermatitis. Now, again, in the previous call, I didn't get into details, but contact dermatitis means that you come in contact with something, but you don't break out for 24 to 96 hours later. So it is a contactant. Now, one of the things, again, that you need to do is take a good diary. See if, when you're on different surfaces, because you said you pray a lot, which I applaud you for, that's fantastic. When you're on your knees, see what surface you're on. Also see, are you applying something to the knee area? Is it both knees? Is it one knee? Are they tiny bumps? Are they large bumps? So one of the things to look at is just that. Is there something you're coming in contact with? Now, the other thing that I want you to be aware of is when you said that you have joint manifestations. Now, some of the concerns about that is some kind of arthritis. So we have to be concerned that you may be developing, sometimes the skin is, some people say that the skin is kind of a mirror, a reflection of what's going on inside of the body. So sometimes bumps on the knees can reflect something that's going on inside the body. And when you start having joint problems, there may be something, an arthritic or a rheumatologic problem going on. And then you want to share all the information with the doc so that person can identify, is there a connection between those bumps on the knee as well as what's going on with your joints? So those are some of the thoughts that I have for you. What can you do about it? Usually when it comes to skin things, I usually tell my patients if I don't have any ideas, I'll say, let's try a steroid, a topical steroid, or an antifungal. For the most part, that will take care of anything. Even if we don't know the culprit, that should help take care of something. Okay. So a topical steroid or an antifungal, and if that doesn't do the trick, continue with your diary and then talk to the doc.
We'll be right back.
return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
Kids will spend 8 minutes decorating their little brother.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
This year, it's estimated that 56 million people will die. Some from old age, some from disease, and still others from terrible tragedies. At HeartWise, we can't do anything about sudden death, but what we can give you is free medical information that will help you live a longer, more fulfilling life with less disease and illness. If you are interested, we would love to talk to you about our wonderful God whom we love and serve, who is with us even when we are going through heartache. If you have a medical question, or if you are just at the end of your rope, call us at 855-644-3278. At HeartWise, we believe in truth, love, and healing.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, in last segment, we've answered some questions that have people with bumps and blisters and things in their mouth. These aren't fun things, but it's nice to know to get a little more information so we're not so scared, because having fear is not good for the body. You know, when we're scared of things or don't have knowledge about things, it makes our adrenaline level, our cortisol, all those bad chemicals go up in our body. So we're glad we're here to answer your questions on Heart of Health Live. We don't sell a product. We just give good, honest information. Now, we can't enter into a relationship, but we can sort of steer you in the right direction. Hunter from New York, you're on with Dr. Raschal. Go ahead, Hunter.
Good day, doctor. Thank you for this program. It's much, much needed, and I appreciate it. I'm a 62-year-old female that I've had several major surgeries, but I'm needing surgery on, excuse me, a throat tumor. I'm a non-smoker. In fact, I've lost 55 pounds in the last year just doing good dieting, exercise, and everything I should do. Yes, it's awesome, and I feel great. But here's the thing. I do have to have surgery, according to my doctor. I'm trying to stave it off. I have 2 goiters, but I actually do have a throat tumor, which, praise the Lord, is benign. Is there anything I can do eating-wise that will maybe either shrink it naturally or something I can do to maybe prolong having to have the surgery?
You know, that's a really interesting question. That certainly is not an allergy question, not a problem. But one of the things is prayer. That's the number one thing. That's the thing that I want you to do, because there are all kinds of miracles that are going on today in 2014. So prayer is a big one. That's exactly what I want you to do. The other question is, just having a goiter is not a reason to have surgery. If the goiter is causing problems, then what kind of problems are being caused? Is it large and it's causing you to have difficulty swallowing? Is it impairing your ability to do things? Is it really secreting chemicals that are hazardous to you. So that really is more the question, do you actually need to have the surgery? Is it causing a health risk? That's why you need to have it. So that's going to be a very important conversation you're going to need to have with your doc about that surgery. Now, whether or not there are things that you can eat, well, one of the things that we know with the body is that the more poison, I'm calling it poison, but I'm talking about chemicals, pesticides, preservatives, all those things, the more of that stuff we put into our body, the more damaging that's going to be to our body. We want our body as pure and healthy as possible. So the very best thing is to eat as clean, I call it clean, as possible, meaning that you're eating fresh fruits and vegetables and things that are good and healthy for you, drinking lots and lots of water. But the other thing that I believe is very, very important is that you want to, if there's areas in your body where you feel like you're deficit, in other words, we know that most people don't get enough vitamin D. Hang out in the sun for a little while, but we got to be careful for when it comes to skin cancer. The other thing to look at is not just eating pure, but probiotics. I believe that probiotics are very, very, very important because, again, the way that the food is grown these days and the way that it's shipped, that ripening process occurs while it's being shipped, we're not getting the nutrients and the fundamental, vital things that our body needs. So I believe that also a very good multivitamin is frequently helpful for people. So those are some of the things that I recommend. Now there's a little bit of controversy about the fish oils, but those things may also be helpful. One of the things to do is talk to your doc, particularly if they have knowledge about nutrition. If they don't, see someone who's an excellent nutritionist who can guide you and steer you in the correct path. But those are some of the things that I strongly recommend. Dr. Marcum?
I agree, and one of the things that we will do for you, Hunter, we'll definitely pray for you. But ask your doctor, well, does this absolutely have to go out now, or can we just keep an eye on it? Now, sometimes modern medicine does need to be done, and it would take care of a problem. Absolutely. And if that's the case, then you want to be as healthy as you can be going into the surgery and afterwards. And I think Dr. Raschal's given some great suggestions to go on. But we will be praying for you, and we just thank you for your call, and we hope you're having a good time up there in New York. So thank you so much for calling. Those are some great questions that people are concerned about. And I think it goes to your comments earlier about how physicians aren't able to spend the time that they have with patients because they're so busy doing so many other things. That's exactly it's not that they don't want to. That's right. It's just that the time's pulled apart. So that's sad. Now, I was reading something recently. I was exposed to something called an alpha-gal allergy. I know you're an expert in allergies, and I've heard of poison ivy allergy, but what is an alpha-gal allergy? What is that?
This is something that is remarkable for us allergists, and I'll tell you why. When someone has a real allergy, and I don't mean a sensitivity to something, but a true allergy to something, it means that IgE, which is one of the 5 antibodies in our system, there is a reaction with IgE and a protein. And when those two come together, essentially, there is a cascade of events that occurs and can result in what we call anaphylaxis. And anaphylaxis is a potentially life-threatening reaction. Now, let's back up a second. You heard me say protein. And remember, protein is in meats, for an example, in milk, those kinds of things. Now, this allergy is very unique. It's a new allergy. It was coined in 2009. That's how new it is. And it is an allergy to mammalian meat. But it isn't the protein, it's the carbohydrate. And typically when it comes to allergies, it is a person comes in contact with whatever it is that they're allergic to, and within seconds or minutes they have the reaction. This is very unique because it's a carbohydrate. It takes 3 to 6 hours before a person has a reaction. But there's something very interesting about this. There's a caveat that goes with this. A person has had to been bit by a tick. And it's specifically at this point in time, we know it's the Lone Star tick. Turns out that the larva of the Lone Star tick is also a biting part of that tick. Most larvae from ticks do not bite. In fact, both the males and females will bite. I've learned more about ticks than I ever wanted to know because of this condition. So this is interesting in that it's the saliva that's in the tick that causes a reaction, not sure what that chemical is in the saliva, that causes a reaction. And the term Galactoside or alpha-gal comes from galactoside, 1,3-galactoside, which is the name of the carbohydrate that is in mammals, mammalian meat. So it causes a reaction to when people ingest pork, lamb, venison, beef, and again, have to have been bit by a tick. A study that was published recently showed that there's a small percentage of people who said that they had never been bit by a tick that had alpha-gal positivity. Because, again, I learned about the tick, when they bite, they secrete this anesthetizing substance, which makes you not be able to feel when you're getting bit and subsequent blood being sucked out. So sometimes you don't know. The other thing that's interesting is people will recognize these bites and call them chiggers when it actually is a tick bite. The larva tick bite looks like, resembles chiggers. So you need to be asking those questions as well. Now, what are the symptoms? The symptoms are frequently hives. Lots of people have hives. More than 90% of the time that a person has hives, if it's chronic, meaning that lasts for more than 6 weeks, 90% of the time we never figure it out. So we call it idiopathic urticaria. That's the medical term for hives. We have discovered now that many of those people who had idiopathic urticaria or who had these hives, turns out had an alpha-gal allergy. And again, it was missed by all of us excellent allergists because the reaction occurs 3 to 6 hours later and not within minutes of eating the beef, the burger, the sausage, the Hardee's biscuit with the sausage in the middle, those things. Now, the other thing, those folks who have that, other symptoms are they can have abdominal cramping, they can have swelling of their face, their tongue, and other things. They need to maintain an emergency medicine, emergency readiness so that they don't have a life-threatening reaction.
Wow. Well, I hope you don't have the alpha-gal, but if you do, get help. We're going to be right back with more questions after this short break.
The Heart of Health Live will return in just a moment.
Meet Charlie. He's a normal guy with a big problem. You see, Charlie doesn't like to eat healthy foods, and now he's overweight and doesn't know what to do about it. Luckily for Charlie, he's found Weight Management by the Book. Weight Management by the Book is a complete weight loss solution that includes 7 DVDs with 5 hours of lectures, a workbook with over 100 healthy recipes, and an exercise band so you can exercise at home. Dr. Charlene McCullough is a nutritionist, author, and speaker, and together she and Dr. James Marcum talk about the practical ways you can manage your weight and do it the way God intended. As it turned out, it was the best decision Charlie could make because he was able to lose weight and feel great. So now that big problem Charlie had is no problem at all and has completely gone away. Don't you want to know how to manage your weight God's way? For a donation of any amount, we'll send you the complete Weight Management by the Book set of DVDs, workbook, and exercise band. But hey, don't take our word for it. Here's what others have to say about our program.
Weight Management by the Book was an answer from God.
I love that this program focuses on relationships as well as diet and exercise.
Thank you for giving me the hope to change and for doing it in a loving way.
So what are you waiting for? Visit our website at heartwiseministries.org or call our telephone number 855-644-3278. I'd like to think that one day, when we get to heaven, we're going to see a list of people. People like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that Heartwise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support Heartwise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
that was so interesting about the alpha-gal allergy. I mean, I just thought that was very interesting, and I was wondering, can you get it if you haven't been bit by a tick and the animal has been bit by a tick?
Oh, no, that's fascinating.
You know, because a lot of animals have ticks on them.
Right. And the answer is no. And it is because of this saliva, the substance in the tick saliva really is the issue. So honestly, we don't know, to be perfectly honest with you, Dr. Marcum, but I believe that, no, I think that you have to have, that has to be part of it.
You know, and we're finding out so many other conditions that were passed on that we don't even know about through the animal products,
absolutely,
the hormones, antibiotics, and what we're finding out is not only does that you get all the bad chemicals, but you alluded to it, you know, our 1 trillion bacteria that regulate homeostasis in the bowels are disrupted.
Right.
And when the bad guys start making things, for instance, on the heart, they start making chemicals that actually damage the lining of the endothelium, which the bad flora contribute to inflammation and cardiac disease now.
Right.
So the body is just so complicated. You
it
know,
is.
It's not like there's one pill for every solution.
That's
the
right.
body's a global working mechanism, and it's very fascinating the way that we've been created. We have got a call from Carla. Carla, you're on with Dr. Raschal. Go ahead, Carla.
Hi, Dr. Raschal. This is Carla. I'm calling
Carla.
from St. Croix, U.S. Virgin Islands.
Wow.
I'm calling because I'm dealing with hives for many years now, about 3 years, and I'm getting hives every day, and my body temperature gets like hot. And I've been to the doctor, and what they recommended for me to take Benadryl. But I'm starting to get frustrated and want to get to the bottom of it to find out what I really have.
Carla, this is one of the most frustrating things that we as allergists deal with. You know, we describe it as idiopathic. And idiopathic means we don't know. But the truth is that we kind of joke about the word and say idiopathic means the doctor's an idiot because we can't figure it out, and the patient's pathetic because we can't help them. I'm not calling you pathetic. I'm just telling you it's a very frustrating condition. You know you're living with it. 3 years, that means that you have chronic hives. Now, as I mentioned, don't know if you heard this, but 90% of people with chronic hives, we never figure out what causes it. But I think it's because we're not asking all the right questions. Just like this alpha-gal, it can present with hives. So one of the things that I will tell my patients to do is maintain a diary. Write down when you break out in an episode of hives, you want to write down everything that you've ingested for the previous 24 hours, things that you could have come in contact with, and I'll explain that process in a second, as well as circumstances. Because we know that when people are stressed out, guess what? They can break out in hives. Someone is about to do public speaking, and they break out in hives on their neck or on their face. So we know that high emotion can be a trigger for hives. What I have found, if somebody has something traumatic that's happened in their life, they can break out in hives. Now, here's something interesting. Say their grandparents' house burned down when they were 10 years old. The dog was killed in that. All these years later, say 30 years later, 3 decades later, your neighbor's dog gets killed for some sad reason. All of a sudden, you remember back to the time that your grandparents' house burned down and the dog was killed. That could set up an episode of hives for you. So that's what I mean about trauma. Those are the things I want you to think about. Did something happen 3 years ago that set this course of action? Now, the other thing is a contact. If you come in contact with something and it's causing hives, I would expect right where you came in contact with whatever that thing was, you can break out in hives. But again, it takes 24 to 96 hours before you break out. So if you're breaking out head to toe, then it would suggest, could it be the laundry detergent? Could it be the fabric softener? Could it be some chemical that you're using in your clothing? The other thing I tell folks is that diary that I want them to do, that they write down everything that they've ingested for the previous 24 hours, all chemicals or anything that's come in contact with their body within the last 24 to 96 hours. And the third thing is the circumstances. Then after that, I will frequently have them do an elimination diet. Not the typical elimination diet, but I will suggest that they do this whole foods plant-based diet, which I tell them right out of the chute, it's going to be difficult to do. But what I want to try and identify Is it a hidden ingredient in something that you are eating or drinking? Is it a chemical, a pesticide, a preservative? Is it something that you are ingesting, a dye? People will put in their mouth, we have no idea what half the things are that we put in our mouths unless we're reading the labels. So if you notice that over the past 3 years you started drinking this energy drink and it has a dye in it, that in fact may be the culprit. So I want you to do just water, and even I can convince people to get off even their coffee, their caffeine for 2 weeks. Get off everything, see if your hives go away. Just fruits, vegetables, and organic meats, chicken and fish. And if you don't eat meat, chicken or fish, then it's just the organic fruits and vegetables. And I want you to do that for 2 weeks. After 2 weeks, hopefully your hives are gone. If they're not, then you need to go on medicines and repeat that process. If they are gone, then I want you to introduce one ingredient every 3 to 5 days to see if they recur. If your hives recur, then that may be the culprit, and that needs to be completely eliminated from your diet. I usually tell you, take that one more time, reproduce the symptoms twice, and that will confirm that probably is a culprit. Because the truth is that all the skin testing that we do frequently will not show what's causing the hives. That's what makes it so tricky. It's based on history. I'm going to give you 2 quick scenarios. One gal had a problem with the chemicals that were used in exterminating the house. The exterminator said, our chemicals are safe. So he changed, and she never had another hive. So it may have been that. The other thing was this one family was demiting their exotic bird cages and put together that every time the husband would demite the cages, she broke out in hives. So it was clearly something that she was inhaling and possibly coming in contact with. So it's difficult to figure out, but hang in there because you'll be able to figure it out. Also pray about it. God sometimes gives me answers to questions before I even ask the question. Pray about it and see if he directs you in that way.
Well, Carla, thank you for calling, and we hope your hives get better. And if you find out what's causing them, we want you to call us back.
Yes.
Let us hear some good news. We always want to hear good news. Well, I think that is a great answer to that question. We got time for at least a quick question that's come into our website. That's heartwiseministries.org. These are some quick ones here. How common are allergies to pets? Do you see that very often?
You mean people?
Pets.
The pets actually have the allergies?
No, the people have them to the pets, right. The people have them to the pets.
That is a really interesting
question. Do people bring in pets with allergies?
Oh, absolutely.
Wow,
yes, and they tell us
that.
about their dogs that's on allergy shots, all kinds of things.
Okay.
It is a very common problem, but one of the issues is how do you detect it? How do you diagnose it? Because the truth is that, again, allergy is to the protein when it comes to the pets. And people will frequently tell me, I don't have a problem with my dog.
Okay.
It's just Aunt Martha's dog that I have a problem with, which is hilarious to me because the protein is going to be the same.
Okay.
But what I have found over the years is the longer the hair, the more likely the protein is going to get deposited on that hair. For example, cats. Let's talk about cats for a second. Cats, the protein comes from the saliva, so they're grooming themselves, they're licking themselves frequently, so they're going to deposit that protein on their hair. Also, it comes from male cat urine and on the sebaceous glands, and the sebaceous glands are on the skin.
Okay.
So those are the ways that they're going to get that protein deposited on the hair. So if the cat has really short hair, they're less likely to have, the person is less likely to have allergies to that particular cat. If the cat is well groomed and kept, what we recommend, no cat in the house, ideally. Don't have a cat. No cat in the house and no cat in the bedroom.
Wow, that's great. We're going to have to go to break. You're watching Heart of Health Live with Dr. Raschal. We'll be back after this short break. Go to more questions. We have a question from Alabama coming up next.
The Heart of Health Live will return in just a moment.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartWiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Welcome back, and for all of you who love pets, don't worry, not that many people. I have pets and I'm not allergic to them, so only a few people get allergies to pets. So if you have pets, I just love my pets, Max and Daffy. I think my wife is allergic to them.
Oh, but it doesn't matter.
No,
because
she's
there's a ton of people
she's mentally allergic to them.
Oh, okay, that's
not
different.
Mentally, because every time the dogs, they do stuff in different rooms that they shouldn't be doing,
yes.
And I didn't train them well, and she doesn't appreciate that, so I'm just sorry about that. But we've answered some great questions about allergies, and it's just very interesting about how our body responds, how the immune system gets turned on, we attack ourselves. And it's not only allergies, but there's lots of disease that have the immune system that turns on.
Right.
Like I've seen people that have the immune disease like fibromyalgia, rheumatoid arthritis, lupus get remarkably better when they do the same prescription that you just gave for hives.
Oh, absolutely.
They find the offending agent, their immune system settles down,
right.
and they can do a lot better. So sometimes, not always do they have to take a medicine that knocks down their immune system.
Absolutely.
Sometimes if they can turn off what's turning it on, that might, but that takes time.
It takes
and
time,
it takes
history, patience.
And it does take some discipline. Okay?
That's right.
It takes some discipline.
Because people don't necessarily want to do that.
Okay, we have Shelley from Alabama.
Okay.
Shelley, you're on with Dr. Raschal. Go ahead.
Hi, Dr. Raschal. I'm talking about my mom. She's 89, and she has been experiencing drainage, sinus drainage, for a year. I mean, we've tried everything over the counter. We've gone to the doctor, and nothing stops it. In between the Benadryl, she keeps draining, and then we give her Benadryl, and she stops for about a couple of hours, and it starts up again. So I'm at a loss what to do.
Shelley, that is very frustrating. And I applaud you for calling on your mama's behalf. That is just wonderful. You obviously love her and care about her, and you wanted to see something different. Here's one of the things. We know that postnasal drip can be very frustrating and annoying, but there are several things that can cause it. One of the most common things, because your mama's 89, it probably is not a whole lot of allergy. And when I talk about allergy, I mean being allergic to trees, grasses, weeds, molds, dust mite, dog, cat, cockroach. Those are some of the more common allergies. But one of the things that can cause drainage in the back of the throat is going to be irritants. Irritants like cigarette smoke, colognes, perfumes, strong smells or sprays, diesel, gasoline, potpourris, pollutants. So that could be particulate matter that's in the air. So any of those things can be irritants. Any irritant can cause swelling inside the tissue in the nose, and when that happens, then you can get drainage. And the drainage sometimes will come out of the front of your nose, but more commonly it'll go in the back of the throat. So that can be a problem. Another thing is going to be infections. And it is not, you said that your mama's had this for over a year, but didn't have it really before then. So that suggests that she may actually have an infection. And that is not unusual to have a chronic sinus infection. There are 4 sets of sinuses. The maxillary sinus is under here. So feel her head touch in this area right where her cheekbones are and see if that's tender. Feel up here. Also, there are sphenoid sinuses, which are straight back here in between the eyes. And then there are ethmoid sinuses, which are along here, 3 to 15 of those on either side of the nose. Press in these areas and see if your mama has some tenderness. If she can bring up some of those secretions, then that may help identify by color whether or not that could be an infection. She's had it for that length of time, and it's green or it's yellow, it may in fact be a sinus infection. She may require antibiotics to get rid of that. Make sure if she does go on antibiotics that she takes a probiotic to give back all the healthy bacteria that antibiotic is going to get rid of. The other thing is kind of a stretch, but I'm going to explain it to you. What happens is some people will have reflux, GERD, gastroesophageal reflux, which means that the gastric contents in the stomach will move up into the esophagus, that swallowing tube. And some people have what's called LPR, or laryngopharyngeal reflux, which means that the gastric contents will actually migrate into the upper part of the esophagus. We believe that there are neuroreceptors in that part of the esophagus that can cause swelling of the tissue inside the nose, which then can cause drainage. Crazy, huh? What that means is that reflux can actually cause people to have drainage in the back of the throat. Is it drainage, especially is it worse when she's laying down? Is it worse after she eats something, which is more suggestive of reflux? Or is it the reflux that's triggering swelling in her nose, then it's draining in the back of the throat and causing her to have symptoms? Take her back to her doc. Yeah. Have the doc look at some of those things. Try and tease out which one of those things is the culprit. Is it because of drainage in the back of the throat, because of an infection? Is it because of weather changes? Is it because of barometric pressure changes? Is it because of the irritants? Is it because of reflux? So that would be a really good start to try and tease out what it is.
Okay, good luck, Shelley, and we'll be praying for you, and thank you for calling in, and let us know how things go. Susan from Nevada, you're on with Dr. Raschal. Go ahead, Susan.
Hi, doctor. How are you doing today?
Hi.
Good.
Good.
I have a question for you. You just were talking about cats, and I've always had a problem ever since my brother's cat, when I was a baby. He used to sit on my chest and breathe. Well, I have problems today because maybe of that, I'm not sure, but when a cat starts purring or is around me, I start having asthma symptoms. What can I do to relieve that, or is it because of the time when I was a baby that does trigger that now, or how can I handle it?
Yeah.
I'm in a house cat now, so I need to know how to combat that problem.
Mm-hmm. That is a complex question in a way, and I'm going to explain that to you. It's easy. The answer is honestly easy to figure out whether or not you are allergic to cats. And a simple skin test will be able to identify that. But I think that what you're bringing up is actually a little more, it's a little deeper. So if I understood you right, a cat was actually on your chest when you were a baby. Now, 2 things. Was that a pleasant experience, or was that more of a fearful experience? Because the question is, well, let me back up a second. Typical symptoms of allergy: itching of the eyes, in the nose, roof of the mouth, back of the throat, and in the ears. If you have itching of your eyes and one of those other orifices, and you have sneezing several times in a row, it's almost always allergy. So if you're around cats and you have itching of your ears, eyes, mouth, and nose, and you're sneezing like crazy, or your nose runs, or you get drainage in the back of the throat, when you are in that situation with exposure to the cat, that's probably allergy. And allergy can definitely trigger asthma. To determine whether or not you're allergic to cat, a skin test would be easy. Go see an allergist, have them do skin testing, and see if that's the culprit. But I wonder if there is more of an anxiety component associated with the cat on the chest, if that was an unpleasant experience for you, if that generated fear in you, and now when you're around the cats, you feel those similar symptoms. The question is that anxiety? And I hate to use that term, quite honestly, because I think, for want of a better word, I'm going to use that word. But are you fearful that you're going to have those similar feelings that you did when you were a baby? And I believe that some people can remember way back then. The other question, are you fearful of the cat and that is causing you to have an asthma attack? Just the fear, because we know high emotion can also be a trigger for asthma. So again, it's going to be easy to figure out whether or not you're allergic to cat, but the fact is that you're still having symptoms when you're around the cat, and if you are not allergic to the cat, then I'm concerned about that fear factor. Some people have a condition called vocal cord dysfunction or paroxysmal vocal cord motion. We're running out of time, but I'll make it quick. The vocal cord should separate when you breathe in. Sometimes it comes together, and that can be a problem.
And we're going to go to break right now, so stay with us. You're watching Heart of Health Live.
The Heart of Health Live will return in just a moment.
This year, it's estimated that 56 million people will die. Some from old age, some from disease, and still others from terrible tragedies. At HeartWise, we can't do anything about sudden death, but what we can give you is free medical information that will help you live a longer, more fulfilling life with less disease and illness. If you are interested, we would love to talk to you about our wonderful God whom we love and serve, who is with us even when we are going through heartache. If you have a medical question, or if you are just at the end of your rope, call us at 855-644-3278. At HeartWise, we believe in truth, love, and healing.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, we're just so glad that Dr. Raschal shared her expertise, and we can't get to every question tonight, but we have two more callers. We're hoping we can get to them before we sign off, and we just want to thank you for being a part of our family. Go to our website, heartwiseministries.org, to learn more. We want to thank you for being a part of this growing ministry that's trying to reach out and help people. We're not like some of the other doctor shows. We don't have fancy equipment, and we don't have a product that we sell. Or you know, all these gadgets, but we just try to let you know that we care about you, and it's about that relationship that also adds to healing. Shellam from Georgia, you're on with Dr. Raschal. Go ahead, and please make it quick, because there's one more call that we need to get on before you.
Yes, I will make it quick. Hello, Dr. Raschal.
Hi.
Hi. Listen, my question is, it's about hypertension. Can hypertension be caused by allergies or an autoimmune condition? That's my question.
Okay.
Oh, that's a tough question.
Can hypertension be caused
by allergy? And the answer is no. Hypertension cannot be caused by allergies. The other question you mentioned, or the dovetail, was autoimmune things. And the truth is that is such a big category. So the bigger question is, can autoimmunity affect the kidneys? Because we know that the kidneys are involved when it comes to high blood pressure. And the answer is that is probably accurate, because we know that there's all kinds of autoimmune diseases that can affect the kidneys. And if the kidneys are affected, or parts of the kidneys are affected, that can raise blood pressure. But there are other conditions that can also elevate the blood pressure. Now, the other dovetail to that, the answer to the question is, there are certain medicines that people take for high blood pressure that can cause, not necessarily allergies, but can cause allergic-like reactions. I know that wasn't actually your question, but the answer is that no, allergies do not cause hypertension, but autoimmune diseases may cause hypertension.
Okay, that was a great question. Cynthia from New Jersey, you're on with Dr. Raschal. Go ahead, Cynthia.
Hi, doctor. How are you doing today? Hi. My daughter had an outbreak recently, and I saw somebody else with the same type of outbreak, and they said that their doctor said it was poison ivy. But when my daughter went to the allergist, they did not know what it was.
Okay.
So skin reactions are very tricky, especially if we can't see them. So the truth is, I don't know if it was poison ivy or not, but one of the things is, A, did the treatment get rid of the condition? And B, did the history fit the condition? So what we know about poison ivy, sumac, or oak, any of those three, it's usually derived from the sap that comes from that plant, and it comes in contact with our skin, and that's how we get the reaction. I mentioned earlier in another segment that contact dermatitis, that type of reaction, means that you come in contact with something, but you don't break out for 24 to 96 hours later. That's the same mechanism that poison ivy that causes it manifests with poison ivy. And what I'm saying is, if you come in contact with poison ivy and it seems like it's getting worse over several days, it may in fact be poison ivy. So the history is going to be key, and especially if your daughter was out in the woods. If the allergist identified it, if they biopsied it, that's going to be more telling. And the other thing we need to look at is other possibilities for that particular outbreak.
Well, Cynthia, thank you for calling, and thank everyone for calling. And Dr. Raschal, we want to thank you. Unfortunately, we're all out of time. If you might have your questions, we'll store them up for Dr. Raschal. Go to our website at heartwiseministries.org. We'd also like to invite you to be one of our Facebook friends and keep track of what we're doing in the newest developments of health. Until next time, I'm Dr. James Marcum, wishing you the best of health.